to refer us to many other partners to work with. And there's something we've always said to different partners, and people have asked, how did we, a young organization founded by a Nigerian in Abuja without any special support or strong Godfather backing or any of those things, build such a reputation? And I say it's simply because of how we have approached work. We've approached work with strong innovation, but the kind of dedication and focus to drive results that you don't see in many other places. A lot of people just want to drive processes and all, but we are very results focused, and we say results are results, no excuses in between. Because in a country like Nigeria and many other countries, you hear a lot of legitimate excuses for not delivering on whatever assignments we've been given. But if you really focus on just getting the results, eventually you find a way by innovation and all. So I would go, I think, after that to the core parts of our discussion today. Next slide, please. On domestic resource mobilization for malaria control and elimination. And I think the first thing, for some of us, we might know that, for some we might not, but just setting the background. The first is how bad the malaria scourge is. In 2023 alone, an estimated 263 million malaria cases occurred globally, causing almost 600,000 deaths, a significant increase from the previous year. Now, with all of that, Africa bore a disproportionate share, having 94%, which is not too far from 100% of all the cases, and 95% of all the deaths. So in principle, the cases and the deaths are happening almost 100% in Nigeria, in Africa, sorry. And 76% of those deaths affected children under 5. In sub-Saharan Africa, approximately 430,000 children died from malaria. So you can see, if you imagine that number in 1 year, and then you bring it down to 1 minute, you're seeing that one child, as we're speaking, 1 minute passes, one child has died from malaria. And that is how much our continent is losing to malaria every single minute, every single hour, every year. Next slide, please. Now, when we double click into the Africa problem and come to our country, Nigeria, we see that Nigeria is also bearing a significant burden, bearing 27% of the global malaria cases. And all, given that, of course, Nigeria is one of the most populated, is the most populated country in Africa. That doesn't give us the need, the justification to have this huge share, but Nigeria bears 27% of the global malaria cases, and all, and 31% of the global malaria deaths, as well as the 40% of child malaria deaths worldwide. And all of these are in 2023, and things are getting worse, and it doesn't get better. And we'll continue to the next slide, please. If we look at some of the different interventions that we've tried to put in as a country to address this, there have been the insecticide-treated nets that most of us will know of. There's the insecticide sprays that we put out from time to time. We buy all the insecticides that we spray in our homes and environments. There's also the seasonal malaria chemo prevention that happens across, the malaria belts and a huge part of Nigeria. And most recently, there's the malaria vaccines that have become available, though still trying to gain traction. Nigeria introduced this recently, but the quantity that we introduced is so limited that for now, I think it's literally not making a dent yet in our malaria situation. Next slide. If we look at the global funding shortages, and I'll tell you more even regarding the malaria vaccine, the global funding for malaria has declined a lot. But even before the decline, the globe was not able to reach the amount that was forecasted for us to fight malaria. 8.3 billion was that forecast, but in 2023, when everything seemed to have been fine, you had a democratic government in the United States, there was a lot of funding, everything was going fine. The world was able to mobilize $4 billion, which is just 48% of that target. Fast track to 2025 this year, That amount has dropped to very, very low levels compared to what we had at that time. And that, of course, is resulting to suspension of the training program, the research initiatives, the distribution of insecticide-treated nets, and a lot of things. And for in Nigeria, our country, after we introduced the malaria vaccines, we introduced the RTSS in terms of the vaccines, and that vaccine, we got 1 million doses. And each child is expected to get 4 doses. So it means that was give or take for 200,000 children to benefit. Now, the expectation was that the country would scale up the utilization of the malaria vaccines because the rollout currently is in just 2 states, Bayelsa and Kebbi. And within those 2 states, there's even small pockets within the states. But we couldn't scale the malaria vaccines. Why? Because we don't have the physical space. We don't have the sufficient resources to procure the huge quantities that were required and also the huge capital outlay that's required because the malaria vaccines are very expensive. And also because of that, we are sort of in a limbo. We have this new malaria vaccine that we can't scale. At the same time, it's also not making a lot of kits and you can't withdraw it. So this is showing how critical it is regarding our physical space and the need to really dig deep into resource mobilization. Next slide, please. So for domestic resource mobilization, I've already touched on some of them, but just so we are clear, domestic resource mobilization refers to the country's efforts to raise and manage its own resources through different means, including taxes, insurance, private sector contributions, as the case may be. And domestic resource mobilization for health focuses on raising those domestic resources, but targeted toward health programs like HIV, TB, malaria that we're discussing today, immunization, and other kinds of health interventions, but focusing those domestic resources in these directions for health. Now, let's be clear. Health is one part. And in health, you have malaria, which is also one part of health. But beyond all of that, if you move away from health, you also have agriculture, you have education, you have nutrition. So you have multiple sectors that are clamoring for the same domestic resources. So how do we make sure that when we're talking about domestic resources, we are actually being cognizant of the fact that we have very limited fiscal space and the need to make sure that we are creating trust. So if we do domestic resourcing right, one thing that is clear is that there will be safer health financing because it will reduce our vulnerability to aid volatility. It will also ensure stronger ownership and outcomes. It will ensure sustained health programs. And at the same time, it will also ensure social and economic returns on investment. And if we did all of these and did them right, we might just be on a path to actually solving our problems. Like I said at the beginning, we are the best solutions to our problems. We have over-relied on external resources for so long, and this is a time for us to really do what we have always been saying, to raise our own resources to solve our own problems. Next slide, please. So there are different types of domestic resource mobilization efforts for health. And for the new one, for those that are new to this conversation, I'll just go through them briefly. But for those that are not new, we know that there is nothing super new on this slide in terms of we want to see how general taxes, raising revenue from public sector, raising revenue from social and community-based insurance, where you want to insure people and get them the right quality of care through pooled resourcing, private sector contributions, and other innovative finance instruments. But what has been clear over the years is these plans have been there in one way or the other, but their implementation has always been the bigger problem. But going to the double clicks of each of them, so for public sector revenue, there are different methods, general taxes or EMAC levies. And a lot of times we talk about sane taxes, where you would say increase the tax on tobacco or alcohol or sweet taxes or sugar taxes and all of that, and be able to apply the revenue you get from there to solve health problems like malaria or other initiatives. We also have the health insurance where the government pools resources and is able to cover large populations of the country with adequate health insurance or of course community-based health insurance schemes too. We also have the private sector contributions where you have corporate social responsibility from different companies and philanthropists, where they also sponsor all kinds of interventions. And private health financing. Private health financing is actually one of the most prevalent in Nigeria because a huge, I think over 70% of the healthcare is sourced from private pockets where we just go in and spend our money and all, not by insurance or other methods. And of course, there are also other innovative finance instruments like health bonds and advanced market commitments, as well as diaspora bonds and micro levies that can all be explored to see how we raise more resources locally. Next, please. Now, just to demonstrate the fact that domestic resource mobilization can be a reality, I'll just do very quick sweeps across 3 countries that have done this successfully, especially for malaria. Thailand did something very innovative. Well, they just did what they said they would do anyway, and that was, excuse me, that was by introducing their national malaria elimination strategy, and Nigeria has one. We have a national malaria elimination strategy as a country too, but one thing they did is emphasize the strong emphasis on domestic investments. They did a cost-benefit analysis that showed the importance of the investments and also the value that will be gained from every dollar that is invested. And then they brought public health officials in Thailand and engage with them at the most local levels, like at the local administrative organization. So you can imagine like our local government areas, engaging them, ensuring they understand the value of the investment they're expected to make. And through all of that, they got a lot of investments coming in to drive the national malaria elimination strategy. And one key lesson from this is a lot of times the focus is on national. We want the national government, we want the federal government to bring money to commit money and all of that. But we forget that the federal government can only do so much. Imagine if you decentralize the resource mobilization. Imagine if you actually yeah, you can move to the next slide in principle. Imagine if you actually decentralize the resource mobilization and got not just the federal government, but the state governments, the local governments, and in some cases, even the wards to actually commit resources and give them the transparency that they need to know that their resources are going to the right places. The next part is Rwanda, where they also had a strategic action to boost domestic resource mobilization. They developed a scorecard that again provided transparency and put some performance-based financing systems in place where they wanted they tied funds to service delivery performance for community health workers, and as they handled malaria cases and were successful and all, they got rewarded by that. And that is saying for the first in the Thailand case, they are talking about raising resources and showing you how your investment would translate to actual change and transparency. Add that to Rwanda's case, they're talking about performance now. So for the resources we've raised, we actually want to make sure that the health workers are doing the right things and the health workers are getting rewarded based on their actual work, not just based on whatever they report and all of that. So that led again to significant improvements in resources and visibility into what was happening. And they gained a lot of investments for their malaria program in Rwanda. Next. Sarah, could you move to the next slide? And for South Africa, I know my time is almost up. For South Africa, again, something similar. They created a malaria investment case a rigorous investment case that was done, that was again used in raising resources, and provincial malaria budgets increased by 36% over 2018, 2019 to 2019, 2020 financial year. That's pretty much over 1, 2 years. They increased their provincial malaria budgets by over 36%. So imagine having multiple countries or multiple states and sub-states in Nigeria increasing their malaria budgets by 36% or even more within just a year. That's how it is when you actually come with data to make a case for investment for malaria or for any other intervention. When we advocate for health system strengthening and all, we know that while it's easy to advocate for more resources for malaria, we always have to take a systems lens because, like I said, malaria is just one of many challenges in the health system, and the health system is one of many challenges in the development system of Nigeria, and that is also one of many. So you always have to look at how do you make a case that is balanced. So you don't look like you just come into, having the tunnel vision, looking for what only concerns you, forgetting that malnutrition is killing a lot of people too, not just malaria and other things. So how do you bring all of this together and have a collaborative approach to driving change? Um, Next, please. For Nigeria, there are different things that have also been done. Of course, we wouldn't go without speaking to Nigeria. And I think it's also good to commend the efforts of the National Malaria Elimination Program that has been driving a lot of malaria elimination efforts in Nigeria with the state malaria elimination program efforts also. However, despite all of these efforts, we know that huge gaps still exist. And we also know that a lot of these efforts have been driven by US government, Global Fund resourcing. If you remove those two sources of fund, then I think the resources we have for malaria elimination work significantly diminishes. And the question comes back, how do we really raise our own resources to drive stuff? We are clear now that going into the next months and years, that there will be much less from some of these sources. So what are we going to do? One is the private sector engagement strategy, which the Federal Ministry of Health has partnered with other reputable organizations like Dangote Foundation and others to mobilize private sector support for malaria, distributing L Alliance, which is basically mosquito nets, as well as advocacy and in-kind contributions. And I always say that the private sector is one of the untapped reserves we have for resources in our country. Um, and they showed themselves very well when they were engaged right during the COVID. Some of us that worked very closely with the government during the COVID efforts and all knew what COVID did in terms of when the different big organizations, private sector organizations in Nigeria came together as COVID and were able to mobilize huge resources that supported the COVID response in Nigeria. But I think after that, I have not seen that unified push again like they had during COVID. Maybe because COVID was something totally, it was a different monster compared to malaria and all of these other problems, but it showed the potential that exists in that platform if engaged appropriately. Now, there was also an example of what EcoBank had done in the past with the EcoBank Zero Malaria Business Leadership Initiative, where they raised $1.3 million across multiple African countries. Now, that is a drop in the basket for what is needed to address malaria needs in our continent. But it's a good, again, it's a good in Nigeria actually imported, sort of is mind-boggling. And it's now that I know a lot of efforts are going on by the Ministry of Health and the government to see how we can produce the right quality malaria nets in Nigeria that we can be using and all. And using all of this and tapping into some of these resources, strategic private partnerships, training and provider mapping, local production, as well as behavior change and policy coordination, I think a lot can be done. And one thing that showed that truly the will, if the will is there, the way is there, is when the U.S. government announced that they were freezing the resources and all for HIV and TB and all. The minister, Professor Lipati, made the case to the National Assembly and to the presidency, and they released significant resources to cover some of those gaps. But it means again we don't have to always wait. So if there are resources that can cover those gaps, it means we can push for even more to cover more gaps, such that we can become totally independent of the global aid space in that way. Next slide, please. So I've put together a few pointers. Now, this is not a framework in that way, but it just points to the different components that are needed if we are to sustainably push the domestic resource mobilization agenda. And the lessons we've learned from the different contexts and many others, again, for the limited time we had to really compress all of this, is one, there has to be that national investment case. And I know this exists in one way or the other from the National Malaria Elimination Program for states and all, and how up to date this is and how reflective it is of today's realities. Because in our country, things change fast. And 2 years ago and today, things have changed quite significantly. But how are we making sure we have not just a national investment case, but one that is up to date and reflects the reality of today? The second is having a diversified funding portfolio. The federal government alone cannot do it. The state governments alone cannot do it. How do we make sure we have different funding streams from different sources to really drive malaria elimination within our country? The other part is data-driven governance and decision making. And this is something that is very important because with technology and all now, everyone wants to be sure that if they are putting in any resource that is actually addressing the needs towards which they have put that resource. So if you're asking, especially if you're talking to the private sector, we as Nigerians, we already know that we have an elephant in the room, which is corruption and all of the other issues that hamper trust within the space. So if you are building a system that actually shows, like I think in Rwanda or Thailand, that if the government or if this private sector is investing $1 in this particular intervention, this is exactly where that $1 is going, and this is that 1 naira or that 1,000 naira. This is where it is going, and this is the change that it is making. That helps a lot in trust building, and it allows people to give more and with confidence. The other part that of course can't be missed out is community and private sector engagement, or more, will I say community engagement. How to make sure that the communities are carried along in all of these interventions and ensuring that they own these processes, because the communities own the children and they own the health workers, they own the facilities. How do you work with those communities to make sure they understand what we're also trying to do to eliminate malaria and support in that process? And of course, manage the risks that always come out from some of these interventions, and making sure that the communities that are receiving this don't see this the wrong way, and all of that, and many other risks that could come out. Next slide, please. So some of the approaches I would run through this quickly, that we already are aware of, but can be built on or grown a little more, is what I've tried to list here. So you have some of the levies, the small taxes that can be, again, like from airlines. Of course, if we take more from the airlines will take more from us. If you take more from the telecoms will take more from us. We know how they transfer some of these taxes. But if the government can actually put some of those resources that have been collected, and target them towards health interventions, and by extension malaria, that would go a long way. The health bonds, raising private capital bonds to fund malaria commodities or malaria interventions, result-based financing, funding for malaria programs, and making sure they are tied to performance metrics and actually seeing change. So we don't just keep throwing in hundreds and hundreds of millions of naira, but at the end, it looks like we're not moving forward. Diaspora bonds, of course, is something that also helps with resources that will be available for health interventions. Next slide. I talked about private sector coalitions. There's also trust funds, crowdfunding, which is like private donations from individuals or from purchase of branded products, or just having a way of pulling even from the larger crowd that can be me or you, not necessarily an organization, but just people who are willing to put in their resources to fight to support the country's or government efforts, as well as human capital volunteering. One thing is clear, not all resources money. A lot of times we make it look as if when you say resource mobilization, you're talking about raising money. Not everything is money. If you're a medical doctor going in to support malaria programs within your community, that's a huge resource. It might not be money, but it's a huge resource. If you have some work you can do, some stuff you can donate, actual items or time you can put in, those are all resources that can also help the efforts of the government. Please move to that slide. Yes. In terms of immediate actions and some of the first steps that are already there, I would say number one is aligning with the National Malaria Elimination Plan and other government efforts, because I think that's the first step. They have done a great deal of work over the last, in fact, that is their mandate to eliminate malaria. And they've been pushing and driving the efforts for resource mobilization for malaria elimination. So to avoid duplicative efforts is to align with what NMEP is doing, the SMEPs, and just engaging to ensure that that government leadership. Of course, the second is, where absent, conducting or updating the investment case for malaria elimination and all. And of course, launching some of these initiatives in different locations as necessary. A lot is already going on to drive increased resources for malaria elimination, but we can still do much more. And I think it's important to urgently also establish a team that has multiple stakeholders with the government on the lead to drive domestic resource mobilization. And also, and to do this, we know the way I like to put it again, resource mobilization does not mean going to National Assembly and putting it in the budget and all of that. There are many other ways, because we know that our fiscal space is constrained. While we want the government to budget more and release more for fighting malaria and other health interventions, we also want to see that other mechanisms are coming alive and are becoming useful in driving malaria elimination in Nigeria. On that note, I think I'll go to the last slide, which is the thank you. Oh, okay. Yeah, I think I'll go to the thank you slide. Thank you in the interest of time and my health. Thank you.
Thank you very much, Mr. Sampson, for that powerful and wonderful, insightful presentation. Clearly, domestic resource mobilization is the key to sustainable malaria control. So we now know that we are the solution to our own problem, and we have to raise our own resources to solve our problem. Your points were eye-opening, especially with the case studies. Thank you very much. So before we move on, I'd like to remind every one of us to please follow us on our social media platforms. I'm sure it's being posted on the group chat now. Please engage us. We have a TikTok page, LinkedIn page, Twitter now X, Beyond the Bytes, NG. Yeah, it's being posted now. Please kindly follow us, engage, share, and help spread today's message far and wide. So now, without any waste of time, I would like to hand over to Mr. Ramon, who will coordinate the question and answer session. Mr. Ramon, over to you. Thank you very much.
Thank you very much. Good evening, everyone. Permit me, I'm unable to turn on my video. My network is currently unstable and I don't know, it's taking me off back. Thank you everyone for joining. Thank you to our speaker. It's really nice to have you here at this time and moment. Thank you very much. So if there's anyone who would like to ask questions, please signify and raise your hand with the reaction box, with the reaction emoji. Please let's ask questions. Let's indicate if you have any questions to ask. Our facilitators are here to answer our questions before we call it a day.
Some hands are up. Ikechukwu and Ibrahim, their hands are up.
Okay. Mr. Ikechukwu, yeah, please. Please unmute your mic and ask your question.
Okay, good evening, everyone.
Good evening.
Good evening, the guest speaker. Good evening, Mr. Moderator. Good evening, the staff, and good evening, all our Capstone members. Yeah, I have a contribution and a question. I think we are not addressing the big elephant in the room. Nigeria is one of the most important countries that we can ever.
Please, can you raise your voice? I'm not sure many people are hearing you.
Can you hear me? Nigeria is a very important country. It is sad that in the 21st century, we don't have integrated waste management plants all over the place. Everywhere you look, Nigeria is still practicing open dumping. And since we know that we are in the tropics, we cannot avoid malaria. I think filth and uncleanness is one of the major contributors of the malaria scourge in Nigeria. I want to ask the speaker what he thinks about that and how we can address this. Because if we have an effective and efficient environmental management system in Nigeria, where gutters are cleaned, where refuse are properly disposed, I think we'll reduce the issue of malaria in Nigeria. That's my submission and that's my question. I want the speaker's take on that. Thank you very much.
Thank you very much, Mr. Ikechukwu. That's noted. Ibrahim, Mr. Ibrahim. Please unmute the mic and ask your question.
Okay, good evening. Thank you guys for putting this together. This is actually very good. Thank you. I don't know if it's Dr. Sampson for your presentation. So I have two questions. First question is this: is it a realistic thing to expect that enough resources can be mobilized to tackle the issue of malaria? Then, if it is so, what timelines are we looking at? Because if, as is apparent to us, the US and some of the foreign people have pulled out the resources they pour into this, it would be helpful to know that what we're tackling is one, realistic, and how long it will take to do it. So I don't know if you can shed further light on that, please. Thank you very much. Loved your presentation.
Thank you very much, Mr. Ibrahim. I think we'd like to take those questions first, then we'll see if we have ample of time to attend the remaining. Mr. Sydney Sampson, do you want to answer the questions now?
Sure. Thank you for those questions and to the two speakers or the asked questions. On the first one about open dumping and waste management, the thing about you're right in that there are multiple factors that contribute to the situation we have as a people, and which is why I kept talking about like looking at things from the systems lens, where there are a lot of interdependencies. There is no, you can't say you're fighting malaria alone and not talk about, the waterways and the pools of water and all of the, making sure everywhere is clean. The water sanitation and hygiene program that exists and is running, in the Ministry of Health, and it's an entire stream of public health work and all the WASH. There's also the malaria. There's also, the environment and sanitation ministry. So there are so many different parts that come together for you to have a society that is free from diseases, including malaria. So when you say, what can be done around it, I would say while those trying to address malaria might not be able to have the budget and resources and all to address open dumping and open defecation and address all of the waste issues, I think that is where the multi-sectoral collaboration or the even intra-sectoral collaboration comes in to say, if I am tackling malaria, I need you to be doing this. And if you are doing this, I need you to be doing this, and how we can all hold our hands together and actually drive development, because it's multifaceted. For someone to develop, like I talked about, you have to be well fed, there have to be proper hygiene. Of course, malaria should be out of it and all of that. So it's just looking at it from that picture. The second question regarding if it's realistic and what the timelines are. I can answer one, I cannot answer the other. The first, is it realistic? I can say absolutely yes. And I can say that because there are countries that have been in our situations that have very well managed and literally resolved the situation. And if you take an India as an example, they may not have totally eliminated malaria, but they are on a very strong path towards that. If you take other, in fact, malaria was not just in Africa. There are a lot of countries that had malaria, including the United States at some point, and they have all eliminated malaria. And in terms of raising the resources that's required, were they able to raise those resources domestically? Yes, they're able to raise them. And you will see that those that successfully achieved these things, they did it more because they could actually raise resources. And one thing that domestic resources help that people don't know most times is that if the resources are raised domestically and in the right way, it drives better accountability. And in those places, when accountability is at the fore of those resources that have been raised, and people know that this money came from this local government chairman or from this place, and whatever, if this doesn't get done, this is going to get done to that person. You see a lot of results happening and things truly change. But if you keep having, in quotes, donated money or free money that keeps pumping in so much, in a huge volume, then we keep going round and round. And whenever it dries up, everything falls apart. Now, timelines for raising those resources, I cannot answer because there are too many factors that are involved. And even though we've had plans in the past to do that, a number of them have not been implemented to the letter in a way that achieve those results. So I might not be able to say these are the specific timeline for which that can be achieved. Thank you. Did I answer all the
Thank you.
questions?
Thank you, Mr. Sampson.
Okay.
Yeah, thank you very much. That answers the question. I think Akama, your hands is raised. Do you want to say something?
Yeah.
You can go ahead. Okay, so in the absence of any other
You
question.
can go ahead.
Okay. So in the absence of any other question, thank you everyone for joining us today. Thank you to our facilitators. Akama, do you want
Sorry,
to say something?
Ramon. Yeah, we have questions. Someone's hand is up on mine. So I wanted her to speak first before me, if that's
I was not
easier.
saying, I was only saying,
Okay, please
okay.
just allow her to speak. Thank you.
All right. Is Ushama the pub? Okay. All right.
Yeah. So I wanted to ask, especially since you worked with a lot of big companies or countries, organizations that have sponsored tackling malaria in the past. It's kind of related to Mr. Ibrahim's question. Why haven't they, for all these years, been able to reduce at least malaria? Instead, it went up higher. What were the challenges? And we know even now, even though we are trying to tackle it, and like what you said, we need order, we have to work together as a group. finance will be involved, which was provided before the cut. So why was there no reduction in the past, and how are we sure there will be any difference now? What were the challenges? Thank you.
All right, thank you so much. Come on, maybe you should take your question now, so so something
Okay.
can take the two together.
Okay, thank you, sir, for that very insightful presentation. The Beyond the Buy projects, we are currently intervening in Jukwe community, and we're using very some game changer strategies. But one of the things I would like to know from your in-depth professional in this regard is, what are the low-hanging fruits for us as we continue our intervention even after the SPPG scope time, because we will continue. What are the low-hanging fruits or strategies for us to mobilize resources to continue the intervention we have in malaria using the Beyond the Buy project as our case study? Thank you, sir.
All right. All right, thank you, Akoma. So, Mr. Sampson, yes, you can go ahead with these two questions. Thank you, sir.
Thank you very much. And for the first question, why had there been no reduction? Now, that is a very big question that I would attempt to answer, because why there's no reduction in malaria cases or deaths can be attributed to so many different factors in different ways. The numbers we got first. Now, globally, there's a reduction if you look at it from a global perspective. If you look at it from the actual number of cases and deaths, it might be increasing, but that's the first part is population. So population is increasing. So every year as population is rising, the while we'll expect the cases to be dropping if you don't do anything, and even if you maintain the support at the same level, just because of population increase alone, you might be having higher numbers of cases and potentially deaths. Now, a lot of interventions have come in, and the second is we are seeing a lot of changes also in the patterns of the malaria cases and all, no thanks to climate change and other factors that are happening, and other things that are changing within our environments, where places where malaria didn't even used to be in that way before, things are changing. And because of that and the limited speed in responding, you still get more cases and all of that. The third, of course, is the resources that are needed to tackle malaria needs to grow with the size of the population. But unfortunately, like we talked about, the resources are diminishing, yet the population is growing. And the population of malaria insects or malaria-bearing insects is not reducing in any way. So what we are seeing also is an exponential growth in potential people that are getting infected with the malaria parasites and all of that, and very limited basket of resources to actually tackle all of that. One thing that we can look at in this kind of a situation where we're saying, and this your question is the type kind of question that donors ask, that funders ask. A lot of resources are going in, a lot is happening over the years, but we're not seeing change. We're not seeing change in that way. It's also the way that the programs are targeted and the cost of this program. They're very expensive doing the insecticide, rolling out the insecticide treated nets. And if you looked at one of the slides of my presentation, there was a part where we're saying that we push out a lot of the nets, but the actual use of the nets is still low. So people use the insecticide treated nets you've given them to go and farm or to go and fish rather, and all because they want you to catch fish rather than to actually use it to protect themselves from malaria. And also they need to also push behavioral change interventions. because people in the villages and all, they want to survive first before being protected from malaria. So if the net is seen as a potential intervention for livelihood rather than for malaria prevention, then they do that. So there's a multiplicity of factors that I can maybe share with you at a later time that contribute to the sad reality that we are not seeing the significant drop that we should be seeing with the resources that have gone in before. The sad part is with this drop this year, it might even get worse, and we don't know what that might be. But we all need to put our hands together and do our best to really make sure that it drops because it takes everyone in this time that, and sometimes as I say, these kinds of things need to happen before everybody sort of rolls up their sleeves and gets into the trenches. Now that we're not going to be having all those monies that we've always had in the past, maybe things will truly change and we start seeing the results that we need. And moving over to Dr. Akoma's question on low-hanging fruits. Sadly, I don't know a lot about the Beyond the Bite project, and I don't know what interventions you're rolling out within the space. So if you enlighten me a bit, I could then share what some of the low-hanging fruits are that might help your program.
Okay, so we have a distribution of nets, sensitized treated nets. Then we also have the medical outreach where we would do testing. So we'll use commodities like the RDTs and also dispense ACTs for treatment. And then we also have a part of it where we have to clean up the breeding sites, some of the breeding sites of mosquito within the communities. And then we then have the advocacy part of it, which will have to interface with stakeholders who have power, interest, and influence in the space. Thank you.
Thank you. I think that's very helpful and clear. And if you ask me, when you said the low hanging fruits, and this is low hanging fruits in terms of resource mobilization, the way I've seen this happen a lot is it ties to that transparency in use of resources. I think as Nigerians, we have a lot of people with good hearts that actually want to give towards good causes. But the main challenge most times is not enough transparency and not enough trust in the system to put in their resources. So if you build a system that shows whoever is investing, just like I think in Thailand, that shows whoever is investing that this actually is where their resources is going to and what it has achieved, then people are more open to giving. But the other part too is having a clear plan, because like I said, not all resource is money. So having a clear plan and budget that says these are all the things that Beyond the Bites needs to do in the year 2025. This is the part that requires actual raw cash, but I'm sure a larger part of it does not require raw cash. This one requires people doing certain things. This one requires some commodities. This one requires some volunteering. This one requires, so if it's broken down in that way and people are advocated to provide whichever component they think they can provide without necessarily pushing them to say we need your money, then I also see people reacting and responding more positively and saying, okay, I can actually send you these RCTs, I can buy them and ship it to you because maybe I don't want to give you money for fear of something, or I can buy this kind of chemicals for you or these drugs, or I already have them, so I will just share them with you. But I think if you had that breakdown, which is clear, and I expect the team already has that, and that becomes a key advocacy tool, you are likely to get resources faster than if we're just looking for Naira and Kobo to drive the project. Over. You're on mute. Akoma, if you said
Thanks.
something. Over from me.
Yeah, thank you. I think
Yeah,
the moderator takes over.
yeah, thank you so much, Mr. Sampson. Thank you for also giving that enlightenment to our project and our work. Mr. Mayan, still raised. Do you want to say something?
Okay, sorry, it's back to the the old question. So I know that the government plays a lot of role in solving the issue of malaria. Example, good healthcare or clean environment or like the bushes being cleared. It's something, even though the people play a role, or the government plays some role. So why I've noticed there've not been much pressure on the government from the donors.
Hi,
Not
how are you?
something that has been done. Instead, like I see some collaboration with some known names visiting the government. So why has that not been done? And is this not a real problem that we should be pressurizing the government, like build roads, work on the debt or the bush, or provide this or that? What do you think about the role of the government in solving this? Because I believe about 50% or so is supposed to be the duty of the government that we as individuals are taking over, especially knowing that we are paying tax or other things, being a citizen. Thank you.
Thank you. Apologies, I'll have to drop off in a few minutes. People have been waiting, but I'll just try to address that very quickly. Yes, good question. The government has a major role to play, but the more I look at the way things are, the more I see that truly, first, we all are government. Government is pretty much all of us. And when we say the government has to do stuff, I think a lot of times is we have to do whatever is within our capacity and let those that we have entrusted to also sort of manage the affairs of the country in some way also do their parts. So you're right, it's the government responsibility, but the government has a lot of constraints, as it were, and sitting with the leaders, some of the government stakeholders and the leaderships, and when you hear their perspectives and their challenges, you literally pity some of them, even though we have our different perspectives of the leadership of our country and the people in different positions. But the reality is that there is very limited resources to do a lot of what we need to do, and there's so much to do because of where we are as a country. So I would say if there's anything we can do as a people, within whatever resource we have, we should do it while we keep the pressure on the government to push. Talking about the donors and all, that pressure is on them. You can be sure of that. I've been in many stakeholder engagements where the government has been called out, where there's a lot of pressure to get the government to do things differently and advocate. So the push is there, the pressure is there. Maybe you've just not seen them in some of the places you might want to see them, but it is there. But while we're waiting for the government to do theirs, I think we can still do whatever bit we can. Thank you. And on this note, I would say a big thank you to everyone, and thank you for again granting me the audience and the honor to speak to all of you. I hope this has been useful and impactful. If there are more comments, I'm happy to always connect through Akoma and all of that. But thank you, everyone, and have a wonderful weekend.
Thank you. It seems Mr. Sampson is already giving a word of thanks on our behalf. We've really taken so much of your time. Thank you so much for joining. Thank you for giving us out of your time of rest. The weekend is always for people to rest and unwind from the day activities and prepare for the week. And we've taken, a part of it. So thank you very much, sir. We really appreciate your time, your dedication, and your support for us. And to all of our listeners, thank you for joining. We really appreciate your time too, for joining us, for engaging with our facilitators. Please, let's on our video now so we could take a screenshot. If you are where you can turn on your video, please do that so we could take a photograph, a screenshot. Akama, do you want to do that for us? I can't hear you, Akama.
I said, let me try. I hope I can make that happen.
All right.
I guess there's some people that are better off with this, but let's see.
Windows and print screen.
What did you say?
You press the Windows logo and the print screen together.
Okay, I'm trying to get it done. Okay, I hope you know everyone. Yeah, I think I've done it. Yeah, I've done, even if I'm unmature, I've done it. Thank you. Thank you for that.
All right. Thank you for joining, everyone. It's a
Thank you,
wonderful time.
everyone. Thank you. Thank you, Sydney.
A
We're
wonderful
grateful.
evening.
Thank you. We had a beautiful evening. Thank you so
Over
much.
to you, Latimbo.
Thank you very much, Mr. Ramon, for that moderation. And as we wrap up, I would like to thank our speaker again, also the Capstone team, our mentors, the all attendees, and I would like to give a special thank you to my mom and my brother for joining this program. Thank you very much, everybody. So please, before we move on, please let's not forget to engage us on our social media platform. Please share, it's been posted on the group chat, on the chat box, and let's keep the conversation going. The fight against malaria requires everyone's voice and everybody's efforts. So thank you very much and have a wonderful evening. Over. Thank you.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you, Brian.